Burns. Burning tissue damage is caused by heat, excessive exposure to the sun or other rays, or chemical or electrical contact. Burnout can be a minor medical problem or life-threatening emergencies. Treatment of burns depends on the location and severity of the damage. Sunburn and mild cold can usually be treated at home. Deep or widespread burns require immediate medical attention. Some people need treatment at special burn centers and follow-up care for months. Symptoms of burns vary depending on the severity of the skin damage. It can take a day or two before the symptoms and signs of severe burns appear. First-degree temperature. This small rash only affects the outer layer of the skin, the epidermis. It can cause redness and pain. 2-degree temperature. This type of inflammation affects the epidermis and the second layer of skin, dermis. It can cause inflammation and red, white or light skin. The blisters may increase, and the pain may worsen. A second deep heat can cause shock. 3-degree temperature. This burn reaches the layer of fat under the skin. The burnt areas can be black, brown or white. The skin can look like skin. A 3rd-degree burn can cause numbness, causing numbness. When to see a doctor, seek emergency medical help for burns covering the hands, feet, face, pain, buttocks, large limb, or large area of the body. Deep burns, meaning burns that affect all layers of skin or deep tissues. A burn that makes the skin look like skin. Burns that appear burnt or with black, brown or white spots. Burns caused by chemicals or electricity. It is difficult to breathe or burn in the air. Take first aid while you wait for emergency care. Call your doctor if you experience symptoms of infection, such as bruising, growing pain, redness and swelling. Burns or a large or incurable blister in 2 weeks. New, unexplained symptoms and important scar causes. Burns are caused by fire, hot liquid or smoke, hot metal, glass, or other materials, electrical currents, radiation, similar to that from X-rays, sunlight, or other sources of ultraviolet radiation, such as bedsheets. Chemicals such as strong acids, lye, light paint, or petrol. Harassment. Problems with deep or widespread burns can include bacterial infections, which can lead to sepsis, dehydration, including low blood pressure, hypovolemia, hypothermia. Respiratory problems with inhalation of hot air or smoke. Scars or cracked areas caused by red tissue, keloids, bone and joint problems, such as when red tissue causes thinning and tightening of the skin, muscles or tendons. Contracts. Prevention to reduce the risk of common family burns. Never leave cooking utensils unattended. Replace the bottle handles on the back of the stove. Do not touch or hold the baby while cooking on the stove. Keep hot drinks out of the reach of children and pets. Keep electrical appliances away from water. Check the temperature of the food before feeding the baby. Do not heat the baby bottle in the microwave. Never cook while wearing inappropriate clothing that can catch fire on the stove. If a small child is present, restrict his or her access to heat sources such as stoves, outdoor grills, fireplaces, and space heaters. Before placing a child in a car seat, check hot straps or buckets. Uninstall similar devices and devices when not in use. Keep them out of the reach of small children. Turn off unused electrical areas with safety caps. Keep electrical cords and cords out of the way so that children cannot chew them. If you smoke, never smoke in bed. Make sure you have smoke detectors on each floor of your home. Check and replace their batteries at least once a year. Keep a fire extinguisher on all floors of your house. When using chemicals, always wear eyewear and clothing. Keep chemicals, lamps, and matches out of the reach of children. Use safety latches. And don't use leaders that look like toys. Set your water temperature thermostat below 120 F, 48.9 C, to prevent overheating. Check the bathwater before putting the baby in it. Also be careful not to burn out hazards outside the home, especially if you are in an area with open flames, chemicals, or extreme temperatures. Burns diagnosis. If you go to a doctor for burn treatment, he or she will assess the severity of your burn by examining your skin. He or she may recommend that you be transferred to a burn center if your burn covers more than 10% of your total body surface area, is very deep, is on the face, feet, or groin, or meets other criteria established by the American Burn Association. Your doctor will check for other injuries and might order lab tests, X-rays, or other diagnostic procedures. Treatment. Most minor burns can be treated at home. They usually heal within a couple of weeks. For serious burns, after appropriate first aid and wound assessment, your treatment may involve medications, wound dressings, therapy and surgery. The goals of treatment are to control pain, remove dead tissue, prevent infection, reduce scarring risk and regain function. People with severe burns may require treatment at specialized burn centers. They may need skin grafts to cover large wounds. And they may need emotional support and months of follow-up care, such as physical therapy. Medical treatment after you have received first aid for a major burn. Your medical care may include medications and products that are intended to encourage healing. Water-based treatments. Your care team may use techniques such as ultrasound mist therapy to clean and stimulate the wound tissue. Fluids to prevent dehydration. You may need intravenous, IV fluids to prevent dehydration and organ failure. Pain and anxiety medications. Healing burns can be incredibly painful. You may need morphine and anti-anxiety medications, particularly for dressing changes. Burn creams and ointments. If you are not being transferred to a burn center, your care team may select from a variety of topical products for wound healing, such as bacitracin and silver sulfadiazine, Silvadine. These helps prevent infection and prepare the wound to close. Dressings. Your care team may also use various specialty wound dressings to prepare the wound to heal. If you are being transferred to a burn center, your wound will likely be covered in dry gauze only. Drugs that fight infection. If you develop an infection, you may need IV antibiotics. Tetanus shot. Your doctor might recommend a tetanus shot after a burn injury. Physical and occupational therapy. If the burned area is large, especially if it covers any joints, you may need physical therapy exercises. These can help stretch the skin so that the joints can remain flexible. Other types of exercises can improve muscle strength and coordination. And occupational therapy may help if you have difficulty doing your normal daily activities. Surgical and other procedures. You may need one or more of the following procedures. Breathing assistance. If you've been burned on the face or neck, your throat may swell shut. If that appears likely, your doctor may insert a tube down your windpipe, trachea, to keep oxygen supplied to your lungs. Feeding tube. People with extensive burns or who are undernourished may need nutritional support. Your doctor may thread a feeding tube through your nose to your stomach, easing blood flow around the wound. If a burned scab, eschar, goes completely around a limb, it can tighten and cut off the blood circulation. An eschar that goes completely around the chest can make it difficult to breathe. Your doctor may cut the eschar to relieve this pressure. Skin grafts. A skin graft is a surgical procedure in which sections of your own healthy skin are used to replace the scar tissue caused by deep burns. Donor skin from deceased donors or pigs can be used as a temporary solution. Plastic surgery. Plastic surgery, reconstruction, can improve the appearance of burn scars and increase the flexibility of joints affected by scarring. Lifestyle and home remedies to treat minor burns. Follow these steps. Cool the burn. Hold the burned area under cool, not cold, running water or apply a cool, wet compress until the pain eases. Don't use ice. Putting ice directly on a burn can cause further damage to the tissue. Remove rings or other tight items. Try to do this quickly and gently, before the burned area swells. Don't break blisters. Fluid-filled blisters protect against infection. If a blister breaks, clean the area with water. Mild soap is optional. Apply an antibiotic ointment. But if a rash appears, stop using the ointment. Apply lotion. Once a burn is completely cooled, apply a lotion, such as one that contains aloe vera or a moisturizer. This helps prevent drying and provides relief. Bandage the burn. Cover the burn with a sterile gauze bandage, not fluffy cotton. Wrap it loosely to avoid putting pressure on burned skin. Bandaging keeps air off the area, reduces pain, and protects blistered skin. Take a pain reliever. Over-the-counter medications, such as ibuprofen, Advil, Motrin IB, others, naproxen sodium, Aleve, or acetaminophen, Tylenol, others can help relieve pain. Consider a tetanus shot. Make sure that your tetanus booster is up to date. Doctors recommend that people get a tetanus shot at least every 10 years. Whether your burn was minor or serious, use sunscreen and moisturizer regularly once the wound is healed. Coping and support. Coping with a serious burn injury can be a challenge, especially if it covers large areas of your body or is in places readily seen by other people, such as your face or hands. Potential scarring, reduced mobility, and possible surgeries add to the burden. Consider joining a support group of other people who have had serious burns and know what you're going through. You may find comfort in sharing your experience and struggles and meeting people who face similar challenges. Ask your doctor for information on support groups in your area or online. Preparing for your appointment. Seek emergency medical care for burns that are deep or involve your hands, feet, face, groin, buttocks, a major joint, or a large area of the body. Your emergency room physician may recommend an examination by a skin specialist, dermatologist, burn specialist, surgeon, or another specialist. For other burns, you may need an appointment with your family doctor. The information below can help you prepare. List questions you want to ask your doctor, such as, do I need treatment for the burn? What are my treatment options and the pros and cons of each? What are the alternatives to the primary approach that you're suggesting? Can I wait to see if the burn heals on its own? Do I need prescription medication, or can I use over-the-counter medications to treat the burn? What results can I expect? What skincare routines do you recommend while the burn heals? What kind of follow-up, if any, will I need? What changes in my skin might I expect to see as it heals? What to expect from your doctor? Your doctor is likely to ask you a number of questions, such as, how did the burn occur? Do you have other symptoms? Do you have underlying health conditions, such as diabetes? What at-home burn treatments have you used, if any? Have you noticed any changes in the appearance of the burn?